in the room. We don't often meet other Paula, so it's kind of fun to say that. So thanks for letting me be off the cuff. Paula is the State Health Officer and the Division of Public Health Administrator. Paula has been with the Department of Health Services since 2021. Prior to this role, Paula advanced public health and health equity efforts in a variety of agencies throughout the state. These include being the director for the University of Wisconsin Population Health Institute's MATCH program, mobilizing action towards community health group. She was also the assistant director of the Wisconsin Center for Community and Nonprofit Studies and the Transform Wisconsin Health Equity Coordinator at the Wisconsin Clearinghouse for Prevention Resources. Paula holds a Master's of Public Health degree and a Bachelor of Science in Biology from UW-Madison. And she was recently selected as the DeBeaumont Foundation, by the DeBeaumont Foundation, as one of the class of 2023 40 under 40 public health leaders. Congratulations. So please join me in welcoming Paula Tran. Paula took my line, the multiple Paulas in the room, but it is fun to be in the space and to be in a room with folks that know of the Paula dual reference, which I am learning that many of our newer workforce members don't recognize that. So happy to be here. It was great to connect with folks, see folks in person. I was telling, I think, David Frazier, where are you? How we're still coming out of the fog of being in person, right? Still learning, how close you can be to people when you talk to them and, where your hands go. So if coming out of sort of the fog is real for lots of us, right? Not just our public health staff, although kudos again and shout out to all of the public health workers that have worked hours and hours and hours over the last several years supporting the response, and as we all come out of the fog, how great of an opportunity it is to really gather and talk about our shared interests that moving our work to advance public health and health in our state. So really excited to be here. I get to talk a little bit about how our Wisconsin Cancer Plan really sets the stage for action all along the spectrum of public health prevention, treatment, and services, as well as action. I'm going to close the loop at the end to talk about how I think now more than ever in such a divisive time and where we are experiencing such polarized opinions, especially about public health, in a way that I'm not sure if many of us have experienced before, how things like cancer control, cancer reduction can really bring us together across the whole spectrum of things that drive our health outcomes in a way that's really critically important now. So that's the note that I want to land on and just offer that to you all, especially as leaders in this particular space. So really appropriate, as Beth sort of alluded to last year, you talked about stories. I'm going to start with stories and talk about how that has driven my own personal action and how I find that to be critically important in the ways that I create partnerships across the state and across the country. So this is my dad. He, and please feel free to intervene on me if I become too loud or too soft. So I'll watch for feedback on the volume. The story that really I hold with me and take with me every day is one on a stolen shrimp boat. So my parents were in their late teens. We think they were about 17 when they were arranged to be married. A very traditional arrangement in Vietnam. They did not meet. There were third-party arrangers reading, their birth charts to understand who they should be connected with. And when shortly after they were wed, my dad, in true activism spirit, decided he was not going to raise his future family in communist Vietnam. Being born in a war, growing up in a post-conflict, he knew that wasn't the life he wanted for his family. So he hatched a plan with his cousins, stole a boat, and began sort of planning to set off for a different life for himself and his family. My grandparents found out about their story, about their plan, and at the time, the government was not so favorable of their young people leaving. So My grandpa told my dad he couldn't leave and camped outside his door with a gun, promising to offer him a humane and if he caught them leaving. So like good teenage activists, they escaped through the window and left in the middle of the night, and several years before they reconnected with our family in Vietnam. They landed in Hong Kong. We're still not clear how long they were at sea or what happened during that time, but they landed in Hong Kong, who was at the time governed by Great Britain, so friendly towards political refugees. They took them in, housed them in a refugee camp, and found out that my mom was pregnant. So they kept them in the refugee camp until they could have my oldest brother and got connected with a resettlement agency in the US. And that is how they ended up in Green Bay, Wisconsin. So kudos to all the folks that are working closely with resettlement agencies. It is a really hard line of work today, as we all know, based on what feels like increasing global conflict. Resettlement agencies do the work of angels, bringing in families that have experienced a whole host of trauma and welcome them into our states. So it was Catholic leaders that welcomed my family into Green Bay, helped introduce them to all things that are Wisconsin, including football, fried cheese, and beer. And that is some of the culture shift that I think we all confront today as we think about the drivers of chronic disease and prevention. And those were the things that also created a welcoming table for my family. So our family grew, and it was the work of service agencies that really allowed my family to survive, right? It was food pantries, emergency food. It was folks donating jackets and clothes to really help us stabilize. And slowly, as my parents settled, many of their family that they left with left Wisconsin because it was cold here. And my parents made the decision to stay because of what my dad could observe as a rich network of systems and policies. He knew that if he stayed here, his kids would have access to healthcare. He knew that if he stayed here, his kids would have access to public education. And those were the primary reasons why he weathered the cold. So, this continuum of service provision to help families stabilize all the way into this rich history that we have in Wisconsin of policies that support folks to make sure everyone has the opportunity to live their best lives and to live well and safe is what kept them here. So one generation ago, right, we assured every child would have public education, excellent high quality public education, and that every child would have access to healthcare. And so I'll lift that up as something that one generation ago was something that brought incredible support across many political ideologies to assure every family had that opportunity and a good start regardless of where they came from. And we weren't sure how we would do. Lots of folks questioned whether or not we would make it as a family. We had lots of challenges and lived in challenging environments, right? We lived in rental homes and we struggled with lead exposure, asthma exposure, the whole range, right? I'm learning now how public health has always surrounded my family and helped us grow and thrive. And again, that rich network of policy and systems here allowed us to thrive in a way that we could not have done if we were in a place that did not see us, include us, and allow us to belong in a way that appreciated what we could become. And so on our data, we started to look kind of equal, right? We all got 4-year degrees from college. We started getting jobs, started owning homes and building families. And what we know in places that have not addressed generational differences in how they treat populations from a systems level and interpersonally, inequities can still show up. Right? So even though, we worked really hard, we accessed services, and we did our best to secure those, what we call social determinants, right? To allow our families to thrive, what we continue to experience across my family's story is inequities in our outcomes. From the babies that were born into my family to my mom's cancer diagnosis. When I was a junior in college, she was going in for a preoperative appointment for something else, and they found a lump in her breast. So no one had ever talked to my mom about screening. No one had ever talked to my mom about how to care for herself and how to think about prevention. And so in an unusual way, which happens to many of us, she found out she had cancer. And so she was taken in, and lucky for us, it was early stage diagnosis, and she had great care in Green Bay, and she is doing well and thriving today. And so we are on the journey towards ongoing survivorship and helping her to continue to understand what she needs to do as an individual and what we need to do as caretakers to help support her. And we know in this room that these stories are more prevalent all the time, right? And there's so much we can do, and there's so much that we are all doing, right, to assure that every person that grows up in our community, lives well and has the access and resources to live well. And when they're experiencing some kind of chronic disease or might have the potential of identifying some kind of diagnosis, that they can get screened early, have access to affordable screening, and get immediately connected to the care that they need to thrive, right? And that their families have the culturally responsive support networks to allow them to be full and whole families throughout the process. So that is our work, right? And those are the stories that I know bring you all to this table. And hopefully those are the stories that continue to drive change in our systems, in our communities, and the way we provide care and support to folks experiencing many challenges, right? We know the nuances of how we need to engage with community members, elected leaders, local leaders, state and federal level about it's not giving everyone the same thing. Not everyone's going to have the same experience in their cancer diagnosis. So we need to do better, right? By understanding, using our data, using stories, using the things that families and individuals are telling us to really tailor our approach to resource allocation so that we get the right resources to the communities that need them and can use them, right? And that's the distinction between equality and inequity when we're talking about how we make decisions and why we need to tell a story about sometimes we need to do different things with different communities in order for each of those communities to observe and experience better outcomes, right? So we're not diminishing anyone's outcomes, but we do need to make different decisions about how resources are allocated so that every community, every individual can have access to those good outcomes. This is a stage picture. I always sort of have to laugh a little bit at myself. I asked my brother to take a picture of my nieces and nephews being engaged. And you know, there's always the one that's sort of roaming. 100% engagement is really tough, right? So this is our work, right? This is how we leverage stories and our data to come together to do shared work and to generate excitement, momentum, commitment, sometimes anger, right? To fuel change. And it's about getting people to come to the table to see that their story matters to the movement, their story matters to the work, and their story matters for the kinds of changes that we need. So this is really what I imagine, what I envision health equity work to be when we center health equity work in any kind of collection action that we do, is that we're co-creating together, right? That is our opportunity that we can change, is that we are creating spaces that fully include and fully see people for the stories and the richness that their histories sort of allow them to bring. And we're creating those opportunities together and having the fullest choices. And that's why I continue to firmly believe in the work of coalition, right? Versus one single champion doing all the work. Coalition work allows us to shape a narrative and shape a set of actions that belong to us that we own, and then that we can sustain the change around. I think that Wisconsin, I've been studying the cancer plan closely, and I'm so impressed by all of the great work that shows up in the cancer plan. You could easily pull the cancer title off of it and put in any health topic, and this plan would be relevant. And I think that is an incredible advantage to bringing people together so they see themselves all across the spectrum of possibility of work that we could do together. So the plan, the vision, a healthier Wisconsin by reducing the burden of cancer for everyone. And the mission is to engage diverse folks in this work to reduce cancer in our state. There are 6 overarching goals and 7 chapters, data cuts throughout. And I just want to offer you a way to think about, as you are bringing folks to the table, how you can imagine a really balanced portfolio of action in your community. So this is one of my favorite box and arrow slides. I use it over and over again. This is the Bay Area Regional Health Inequities Initiative framework for thinking about a set of actions to really improve health of communities. All along the left, on the left side, you'll see what we in public health like to say is upstream, right? So going way upstream to those root causes. And then on the right is what we call downstream work. Also critically important, but that is to reduce morbidity and really reduce mortality, right? Keeping folks from dying. So all across this huge spectrum, we have the capacity to engage in really comprehensive change. On the far left side, this is what I tend to consider more emerging public health practice, right? That it historically for public health folks, especially when we're working alongside of our healthcare partners, we have been doing the work to deliver high quality healthcare, right? Connect across the healthcare continuum, support case management so folks are getting the right care, and addressing risk behaviors, right? Helping people understand individual changes that they can make to live healthier lives. And what we have found over the past 20 years is that's great work and not sufficient, right, to get at the very root drivers of poor health outcomes. And there we've added the living conditions, which we like to call the social determinants of health, and public health, which includes social, economic, and environmental factors, right? Where you live, learn, work, worship, play, and all of those conditions, all of those spaces and places and factors shape our capacity to have good choices and opportunities to be well. And what we have seen is, parks aren't randomly allocated. Good grocery stores are not a natural phenomena, right? Sidewalks don't just crop up. There are actually places of decision making that we can all be at that allocate these resources, right? So even before the living conditions, what is a precursor to those living conditions is an opportunity for coalitions like this to be at the table to help drive how those resources are allocated, to have a say-so in which community might need another affordable grocery store, which community might need better lighting so that kids feel safe to play outside, right? So what my research has focused on has been about the precursors, the things that shape the social determinants of health, which are places of decision-making and our sense of opportunity. Can we even imagine that every community in our state could have access to these resources? I don't think we're all that imaginative when it comes to that, right? We have not made it work. Anywhere in the country, we continue to have gaps in opportunities to be the healthiest we can be as communities. And I think it takes coalitions like this to reinvigorate that kind of creative thinking and accountability, right? I think it's possible. I think we have enough resources in this country to make sure every family has what they need to have the opportunities to be healthy. And so it takes coalitions like this to help us all get creative about how we make decisions to allow that to be true. So these are all those drivers and the shapers of the living conditions, or where we live, learn, work, and play, and has cascading, multiplying effects across risk behavior, disease, injury, and morbidity and mortality. And the Wisconsin Cancer Plan maps its work across the spectrum. So within the first chapter in health equity, there's a lot of conversation around increasing capacity to reduce the burden of cancer for everyone, increasing the number of Wisconsinites with access to quality care, and prioritizing benefits to populations experiencing the highest risk. That is a health equity strategy. When you're talking about prioritizing resources for those that need it most, these are challenging things to make happen in decision-making tables, and it is the only thing that will assure that all of our communities will be healthier and well. And that's sort of further upstream in the spectrum. As we move down and through the chapters of the plan, we talk about risk reduction, talk about early detection and screening, right? Which makes me think of my mom, especially, right? She was so lucky that we accidentally found her cancer. And the reality is every individual should have access to early detection and screening, right? So this work is so critically important. Treatment, once we find cancers, that everyone has access and can use high quality, affordable care, right? That we make that happen for communities and individuals. Survivorship, right? I was so grateful to see the section in the plan that, you know, once you achieve success in your treatment and you get the good news that you're free of cancer, what is the ways that we support those individuals and their families to continue to pay attention, be vigilant, but also live healthy lives. We're really grateful to see that chapter, and then certainly the end of life piece, which I think the U.S., for all of the rich cultures that we bring together that honor end of life care, we have so much to grow in this space to honor the dignity of every individual and the choices that they want to have access to in their end stages of life. So just kudos again. I know this plan was a work of many, and just want to lift it up as a invitation to really call many stakeholders to the table. I was on a call with local health officers in the Western region yesterday, and they were talking about how, you know, they might not be able to talk about maps or other sort of public health interventions that might support things that maybe are too soon for communities to really dig deep into. And they're able to have conversations right now about cancer in their community. So this is, I think, a opportunity to create entry point to a much broader conversation around something that I think people are really wanting to come to the table around. So these chapters have priorities, strategies, and action steps, such a great menu of options for any local community looking to dive into work. And want to really lift up a couple of key strategies that I saw. One around building trust, right? Really difficult to do this work without being vulnerable, being authentic, being genuine, and coming to the table with that commitment to each other, right? That we're not going to get a whole lot done if we only center our own agendas. So how do we come to the table and build those genuine partnerships where it's a win-win for everyone coming to the space to take action together? Action to address disparities. Again, we will not reduce the overall rates of cancer in our state without taking a close look at the disparities in our state. Here we see the continued disparities between Black and white women in Wisconsin related to breast cancer. I promise there won't be a ton of data slides. I'll leave that to the panel coming up after me. But what we can continue to see, right, are these gaps in our communities and the opportunities that we have to really channel resources to close these gaps. This one around breast cancer mortality. And action steps, right, across the spectrum again. And I think having this comprehensive set of actions where folks are really passionate about the work to support individuals to have the best information and the best resources to take that individual level action all the way to healthcare system change as well as policy change. Wanted to also lift up the actions to reduce risk. Also think this is a great opportunity to really sync up with other coalitions doing work in communities. When we think about risk along the chronic disease prevention spectrum, I think there are so many opportunities to connect dots, right, across groups working on alcohol, across groups working on tobacco prevention, folks that are working on substance use right now, which has many resources, right? So how do we tell a story to link up our shared work so that together we are optimizing the resources that we have and the kinds of work that we're doing. And big picture, we hope that we continue to align our plans at the state to continue to pave the way for local and state work around a variety of plans. So I'll just feature quickly our Wisconsin State Health Improvement Plan. We will soon be publishing the fuller implementation plan, which offers a bit more detail on the framework. But this plan also lifts up the stories of thousands of Wisconsinites, local leaders coming to the table to tell us what they saw the state should be improving. And this is our framework that sets a vision really aligned with the cancer plan of all people and communities in Wisconsin having the opportunities and support they need to reach their full potential. And we see these plans as reinforcing narrative, right? Reinforcing the ways that partners can come together and reinforcing the ways that resources can be aligned and braided to support broad efforts in communities. I'll flag specifically the foundational shift around continuing to center community-centered resources and services as we strategize across systems, and also, again, those social and economic factors. Another plan that I wanted to offer that was really written by many stakeholders across the state. I think some of you are even in this room that participated in the Governor's Health Equity Council. There are many recommendations in there that can also dovetail with the work that is highlighted in the Comp Cancer Plan. I'll call it specifically the role of community health workers as I think a critical strategy to really bring a culturally responsive lens to especially healthcare service delivery and coordination of critical human resources across the continuum. I'm going to just land here, and then we'll have some time for questions. As y'all think about strategizing for collective action, I've been working with partners across the state for some time to provide training to coalitions and also evaluate the impact of coalitions, which as it turns out has been really tricky to do, to tell the story about how a coalition itself is creating impact is I think a story that we still have yet to tell, right? Hopefully we can continue to collect those stories across the state so that we can do a better job to assure sustainable resources to these coalitions across the state. But we find that those coalitions in particular that are thinking about how they're setting tables to grow power intentionally across communities, especially those communities that have historically been left out of decision making, are doing the work to really increase the capacity of individuals to tell closer stories that are closer to the issues, right? So the more faces and stories that we have that represent the issues that we want to tackle and address, the more capacity that those communities and those coalitions have to really center those inequities that we were talking about. And they tend towards, when those coalitions are diverse and represent those folks that are deeply impacted by the issues you're addressing, they tend towards building strategies that are across that spectrum, as I shared. So they're going further upstream because they are closest to those issues of feeling those social determinants, creating barriers for communities, right? So these coalitions that then can lift up the voices of those impacted, as well as work across maybe non-traditional partners, right? Engaging folks across the spectrum of agencies and community-based organizations, the public and private sector, that kind of rich diversity in a coalition can also reshift narrative in communities. So that's that third piece of the how. And again, redefine what we think can be possible in places of decision making, right? That historically, I think many communities have followed a sort of standard protocol of how we fund and how we allocate resources. And I think it takes diverse coalitions bringing those many stories together across many organizations and sectors to really help us see broader possibilities for our decision making and how we get those resources to the place that really can advance equity and close those gaps in those outcomes. With that, happy to take questions or give you a longer break.
Do we have any questions? We do have time.
So thorough. I was thinking about the first bullet under survivorship, and I can't remember the exact framing of it, but it just struck me that that one bullet is doing a lot of work. There we go. Awareness of issues relevant to survivors. What's going on in that space that you could talk more about? Because I think about things like the economics of survivorship being so huge, and I wonder if that's part of this.
Yeah, and I think this room is probably full of folks that can speak to lots of strategies in this space. I'll speak personally. So the economic challenges were certainly some that I think for folks that were otherwise healthy prior to their diagnosis, coming back from treatment and not being the person you were before your cancer journey, I think really deeply affected how my mom could come back to the workforce, right? How she came back to being a wife, how she came back to being a mom, her whole identity changed. And she experienced a lot of things during her treatment that were really challenging, that we had to make sense of as a family. That she did experience some discrimination from providers and also from other patients in treatment that we sort of had to work through as a family. So I think for folks, there are, I'm sure, many, many unique stories. And if I can sort of zoom out and think about the economic supports of folks, the mental health and well-being of folks, sort of what feels like re-entering life after treatment, were really important things that we had to support my mom around to help her feel like she could, quote unquote, live a normal life again. But I would really love to hear how others are doing work in that space.
Oh, real quick, I think, when you said that's an important one, I think it's for exactly that. When I started in cancer 20 years ago, I felt like, hey, you're a survivor, good job. And that was it. It was like they were off. And we didn't have as much of the awareness as we're trying to build today of that. It's not like you're out of treatment, you're good, you're just back to normal life. Because there's the emotional, there's the physical. And we've talked more and more recently about childhood cancer. And when we see the survivors of childhood cancer, that is a lifelong journey. And how do we continue to build that awareness that we as a community need to continue to support after the diagnosis of the co-survivor, the survivor, and especially as we see our young people growing up and going new places, and how do we support everybody? So I don't know if there's other thoughts on it, but I thank you for bringing that up. It was truly important for us to do it.
Yeah, some eagle eyes. I'm sure if anyone would be able to read those, appreciate that.
Good morning, Paula. I really appreciate you framing cancer as the potential for entree as sort of a just non-partisan topic that everyone can come around. Are there other places where you've seen this work? And can you just provide examples of any examples of like, how do you get those conversations
Yeah.
started and how do you build those coalitions to be able to actually, come together around?
Yeah, so we were just listening to the story yesterday again with the Western region. So Monroe County does legislative exchanges, and the health officer there, Tiffany, has been asked to speak at the last two legislative exchanges. So they bring their elected officials, regardless of their political identity, right? They bring them to a space and have conversations about topics that they care about. And in the last one, they were talking about their cancer incidents, that they're really concerned about the number of children being diagnosed with leukemia, specifically in Monroe County right now. So I think those of us that are tracking the data know that there are a lot of challenges with pinpointing the exact reason or driver of cancer. So I think that is one motivator that brings people to the table, is bringing people to the table right now. And what a good opportunity to talk about all the things that we know shape cancer outcomes in our communities. So I think that's one example of the sort of emergent interest area of folks, across the aisle that are deeply concerned about their kids being diagnosed with cancer. And after that happens, are they getting the care that they need? So that's maybe too soon to talk about like a outcome success, but I think anytime you're bringing folks to the table with really deeply different political ideas on a topic and they're getting excited about change that you can make together, I think that's a win.
Hey, Paula, I work a lot with community health workers. Really happy to see you highlight that. And well, I can see some concrete examples of CHWs being part of the continuum of care for cancer. I'm wondering if you could speak to what are the concrete examples and ways you think community health workers could be part of this continuum of care?
Well, thank you for asking the question. So I think community health workers are incredible resources across the spectrum of prevention, right? So if we have folks that are positioned as community health workers to support asthma education, right? Going into homes and doing health assessments, so that early education, early detection, exposures in a home, getting that kind of information to families and doing that level of education is sort of early on in the spectrum. And then of course, when it comes to treatment, helping to support the navigation of care, helping to close the loop on different kinds of referrals across social determinants or other non-clinical resources or clinical resources, right? So, if I imagine that if my mom was working with a community health worker, she probably would have gotten connected to other peer support groups, connected to other economic resources, connected to maybe caregiver groups for us, right? And also just closing the loop on, some nutrition suggestions that were made for my mom, to my mom from her care team, and just being a part of that care team, which is really one of the few ways that we have a sustainable fiscal mechanism, right, to support CHWs right now, is if there's a CHW on a care team that is reimbursable today. So really thinking about across the spectrum of how CHWs can really enhance a care team. And I think CHWs support not only great work individually, but they also then allow the rest of the team to operate at their full licensure too, right? So that sometimes the, surgeon isn't the best person to give, my mom nutrition information, right? So really, I think CHWs can create such tremendous assets all along the spectrum, and a critical part of a care team individually to really support culturally responsive resources, care, and education, while really enhancing the full care team. And I know there are lots of CHW experts in the room, so would welcome anybody to add anything that I might have missed.
Okay? Thank you, Paula.
Thank you.